Hello, Cheers to Business listeners. I'm Ashley Smith, Vice President of Wholesale Pharmacy for DocRx and listener of Cheers to Business. And I want to tell you about the great company I work for. DocRx is a family-oriented company dedicated to tailor operational solutions for patient health and compliance programs that increases the quality and efficiency of patient-centered care, and always with the mission of the patient's health first. With over 10 years of experience helping doctors and their patients with diagnostic tests, patient monitoring, medical supplies, compliance, wholesale pharmacy, physician dispensing, billing, and much more. DocRx is your patient and health compliance solution, both under one roof. To find out how DocRx can help you, your hospital, pharmacy, physician's offices, and any PPE you need for your businesses, please visit us at docrx.com. That's docrx.com, DOCRX.com. Now enjoy the show.
You know, back in March, when you're going from that many patients down to 15, it was horrible. And a lot of people were furloughing doctors. A lot of people were laying off people. I would venture to say we're one of the few, if not only, doctor's office in Mobile. We didn't lay off any physicians. We just have really good partners, and we care about our docs. We care about our staff. We just hung tight, took a loss, and hoped for the best, and tried to come up with new ideas and new ways of generating income. And that's where telehealth comes in. That's where testing on the side comes in. That's where preoperative testing comes in. We did a lot of stuff that people maybe weren't interested in. We were able to get through. And now you ask me, it's a total different ballgame. Now it's the opposite. We're trying to take the load off the clinics. But I'm also wary enough to know this could change overnight, and we could be back to no patients again.
Hey everybody, welcome to the show. Today we have Dr. Darren Waters. He and his sister had the Greater Mobile Urgent Cares in town. They're not just physicians, they're also business people. And I'm so interested to hear what's going on with him, especially during these COVID times. Hey, I'm Karen. I'm a former CPA, entrepreneur, business consultant with big ideas.
Welcome to Cheers to Business.
Dr. Darren Waters of Greater Mobile Urgent Care. Welcome to the studio.
Thank you. Glad to be here. Thank you for having me.
So I actually had met you years ago when you first opened the first Greater Mobile Urgent Care. Did you realize that?
Of course I did.
No, you did not. I said, do you remember me? And you went,
right
no.
when I walked in the door.
No, Lisa Peacock, who is a wonderful CPA, back when it was Sermon Pulaski, Sermon Simmons, and she helped you get started, I think.
She did. Lisa's wonderful. I still have a lot of respect for Lisa.
Oh, absolutely. She's just a good person, too. So I knew you from there, and, of course, watching the urgent cares grow. Now, I happened to run across the Swain Sinus podcast, and you were a guest on 2 shows. I went and listened to it.
Uh-oh.
Everybody wants to know your story and how you started. I want to know about what's right now. So back in October 23rd, 2017, so 3 years ago, I noticed a couple of interesting things. One, you had 5 urgent cares at that time. So you've gone from 1 to 5.
Okay.
All right. So how many now?
We have 6.
6. So you've added 1 more in the 3 years.
That's correct.
Okay. So what tempts you to add a new location?
More customer need. There's a big need for urgent care. There's a lack of access to primary care in the community in general. And urgent care bridges that gap where, hey, you don't want to go to the ER, you're not sick enough to go to the ER, and you can't get in to see your doctor, and that's what we're there for.
I think it's just brilliant. Where'd you get the idea? Were they already popping up around the country?
It's all my idea. I'm just kidding. It's been around the country. This is not my idea. I actually went to a consultant out in Chicago, and they're all over the place in Chicago, and we worked with them and came down here and started Greater Mobile Urgent Care.
I was involved back when I was with the old firm. We did a lot of medical work. And I noticed that not all physicians make good business owners.
Yeah, that's definitely correct.
Yes. Or their wives don't make really great office managers.
Correct.
Yes. You didn't know I was there, but kind of watching over the years. And what I've been impressed with is that you are a physician that's an entrepreneur. And that's a very vague term now, but it doesn't have to be. Because I think that you found a need, and you said it just a second ago. And I think that is so smart, because if there's a need and you price it right, you have yourself a business. So you said on that show that open 24/7, fast and great service, and no ER.
We're not open 24/7. I'm available 24/7, but unlike that is where there's always a role for the emergency department. Heart attack, stroke, very sick people, they need to go to the ER. We're not trying to replace that at all. We're open at our West Mobile location till 11 o'clock at night. So after that, there is nothing else open but the emergency department. But we've even timed things out by what we see in the community. If you drive around Mobile in general, after 10 o'clock, it's dead. So we pretty much limited our hours to what we thought the community needed. And then the rare situations after that, that's when you still need to go to the ER if you feel like you can't wait till the next morning.
So how do people know when they need to go to the ER?
And that was the hardest part about educating the public at the very beginning. Shannon and I went to several talks, Rotary clubs, things like that, and we put it on our website. But any life-threatening, I got chest pain, severe abdominal pain, weakness, loss of use of one side, worst headache of my life, those are things that need a higher level of care. You need to go to the ER. I've been shot. Go to the ER. Believe it or not, they've shown up at our front door. And of course, when we're not open, you need to go to the emergency department.
What do you think, even for small offices, urgent cares, what's the biggest problem right now?
One of the main problems we're having right now is we can't handle the call volume.
Are they trying to make appointments?
They're calling in to get results. They're calling to see if we have the rapid test. They're calling to see do we do PCR. They're calling, you name it, they're calling, hey, I need a school excuse, work excuse, I was just seen, I'm not feeling any better. You name it, whether it's front desk calls or nursing calls. And we can't get to every phone call caring for the people and caring for the staff. And then you hear, hey, you need to just hire more staff. Well, I've hired 3 more people. 2 of them just went out with COVID. And we can't hire any more staff than what we're doing. So, that's one of the complaints we get. So we've even put a partner. My sister now is doing nothing but answering emails.
Wow.
info@gmucare.com. So, hey, what's my result? Hey, I need to be tested. I want to go to the hut, whatever. And she spends all day just sitting there doing emails. So we're trying to come up with solutions, but a lot of it's clinical questions that they do need to speak with somebody. And people understandably get very upset when they can't get through. I get upset when, you always hear you can't speak to a human and you're speaking to a robot. I get upset too, and I get it. But I don't want people to think that we're not doing our best to try to get to the phones.
So how much are you really involved in more on the medical side or on the business side?
Both. It's been a gradual transition. I was heavy on the medical side at first. Here lately with COVID, I'm heavy on the business side. It seems like you wake up at 5, 6 o'clock and you start on the administrative side and you end at about 11 o'clock that night. So I would rather be doing the medical side of it, and I'll get back to that. But right now I'm more heavy on the administrative side.
No, I think that makes sense. That's logical to me because of everything that's going on. Now, my husband and I actually own Medco, which is the courier company that picks up the COVID test. And so you have a testing center. We call it the hut.
So do we.
Do you? Okay. So talk about that. How did that start? I mean, what prompted everything?
Well, when the pandemic first started, it was everybody was scared to go anywhere. I mean, literally everybody's on lockdown. Nobody went anywhere. And certainly nobody would go to a doctor's office. We were seeing, prior to the pandemic, we were seeing, I'm just going to bring up one clinic, say West Mobile. We were seeing 100, 120 people a day. When the pandemic hit, we saw about 15 a day. Nobody wanted to come in. So what we started doing is we set up little tents on the outside of our clinic when we could get the testing, and we started doing PCR testing outside of our clinics. That way people didn't have to come into the clinic. They could get tested and they could leave. And part of that was telehealth. It's, hey, you don't have to come in to see us. We'll talk to you on the phone. If I think you need a test, I'll send you up there for that. So that was great. And then it became popular, and we noticed we were swabbing people out of a tent on each of our clinics. In fact, our Spring Hill clinic, we're swabbing people underneath a canopy by a dumpster behind our clinic, and it just didn't look real professional.
Right.
So we got lucky, and the old Pizza Hut became available in month-to-month lease because we don't know how long this is going to last. And we took that over, and it's worked out great. It's just a drive up, get swabbed, and leave. You don't even have to get out your car.
About how many people come through a day?
Through that location, like for instance, yesterday we had 130, and So it's anywhere. It varies. We could go from 70 to 130, but it's pretty busy.
Now, I've seen the test ramp up over the last, probably the last week especially. And what I'm hearing, the feedback, is that the drivers are hearing that the rapids, they're just going back to the PCRs, which are more accurate.
They both have their role. The rapid, you have a lot of people who just want a quick and dirty answer. Hey, my husband had it, and it's been a week. I just need to know if I have it. Personal satisfaction, and they get a rapid. So there's definitely roles for rapid. And now with the new CDC criteria where you can test out of quarantine after 1 week, most people are doing the rapid for that. I like the PCR, and what I prefer to do is when people call me with telehealth is I'll do a rapid, and if it's negative, I back it up. Because the majority of them are, I back it up with a PCR test. And that way you're giving them a quick and dirty answer, and you're going to back it up with a confirmatory test like a PCR that's more sensitive.
So they get swabbed twice?
It's an extra swab. But you'd be surprised. People are very accommodating. They understand we don't want to do it either. But, yeah, it's an extra swab.
Yeah, I've done it twice. I don't look forward to doing it again.
And when we first started this, like I said, people understand. I got complaints that we were too nice. Like, hey, they swabbed my nose. It didn't feel like a brain biopsy like I heard. And it took a lot of training with our nursing staff. And now they're great. I don't get that complaint anymore. They get the brain biopsy. My son said he felt it behind his eyeball. He wasn't real happy with me.
Yeah, that's pretty much how mine, because I went to Coast Diagnostics to get tested in my car, and they came out to me, and I said, you got to stop.
Yeah.
I was a weenie.
It's pretty aggressive.
Well, it's interesting to hear your thoughts on telehealth, because in the podcast you were on, which is very interesting, I encourage everybody to go listen to Dr. Swain, that you didn't like telehealth at that time.
That's correct. And I still don't. Where our telehealth comes in, and when we first started this pandemic, it was a generalized telehealth, and you were treating more than what you wanted to treat. And we would ask people, please come to the clinic, please get an x-ray, and nobody would come to the clinic. So it's either ignore them and don't do anything, or do the best you can through telehealth. So right now when we do telehealth, literally I'm texting with my administrative staff now, it's for your asymptomatic, your exposures, I'm going to try to test out of quarantine. Things like that are the people we do telehealth with, and we run them through the hut. If you have symptoms, we want you in the clinic.
Okay.
I would rather see you in person, do vital signs, listen to your heart and lungs, and evaluate you than do the generic telehealth, which is what we were talking about way back when, and people still do that. But it's just you've got to evolve with the times. And what we always try to do, and what I've always done, is I just try to do the right thing. May not always end up being the right thing, but it's what I feel I would do for my family and how I treat my family. And so that's where even telehealth's evolved somewhat.
How do you think it's going to change for the future?
Oh, it's going to be a big part of medicine, and I don't necessarily agree with that. And you may have me back here another 2 years, and I'm like heading up a telehealth company, but that's
the entrepreneur again.
Yeah, I would rather people come in. I would rather put hands on them, listen to them. But now people are getting so used to telehealth that they're going to call and say, "Hey, I just need a Z-Pak." Well, necessarily agree with that, and there's plenty of doctors that will do that. But I would rather evaluate you first. And there'll always be a role for offices. You can't get a Decadron or steroid shot through a phone.
Right.
So there's always going to be a role for doctors' offices. And there's a role for telehealth. I mean, right now, our role for telehealth is we're trying to take the load off of our offices a little bit, because just like every other urgent care in town, we're overrun. And it's not just us, it's every urgent care.
Every parking lot you ride by, you see them.
That's correct.
Now, back in 2017, you said your top tests were flu, strep, mono, UTI, x-rays, and EKG. And besides, of course, COVID being the obvious, ugliest elephant in the room that we could imagine, has that changed any? Because who's got the flu now?
People do have the flu, and we kind of call it fluvid. But we've had people that have flu and COVID, positive for both. We are not seeing as much flu as we normally see, which is fantastic. And I think that's got a lot to do with people are distancing and masks and things like that. But it's still there. I mean, the list of tests really hasn't changed. Now you can throw in the PCR and the respiratory panels and things like that. So we've just added to it. But all that's still pretty much the same, except, put COVID up there and then say COVID 10 times and then start the other tests.
Now, I heard, well, I actually knew this already, but something we have in common. You're in business with your sister,
That's correct.
and I'm in business with my brother. My brother and I own a manufacturing company. We build and repair manifolds and heat exchangers and ship them all over the world.
So are you the smarter? I'm definitely the smarter one in the business relationship.
No, my brother is a lot more book smart, but I have common sense.
See,
And he listens to this show, so don't get me wrong tomorrow while I'm there.
my sister has no book smarts, no common sense.
No, that's a lie.
And just got out of prison. But other than that, she's a good partner.
Is that why she was the chief resident when you were?
That's another interesting story because I was the intern when she was the chief resident.
Oh,
so,
please talk about it.
Yeah, we realized pretty quickly that when we got in a fight, it wasn't appropriate then to say, I'm going to tell dad or I'm going to tell mom on you. And that didn't sound right as residents and chief residents. And I might have gotten in trouble a few times for sewing a voodoo doll to the back of her coat and letting her walk around the department. And there's some stuff that happened, but she's the reason why I went to University of Kentucky because I figured, ironically, I figured I'd never work with her. So I was like, you know what, I'll do the same residency. We'll get to be doctors together for at least 1 year before she leaves, and this will be great. So we were doctors together, and it was actually turned out to be really nice, and we enjoyed it and helped each other out. And then she went on her way, I went on my way, and we kind of reunited and started the business up.
So whose idea was it?
It was mine, I think. It's been so long ago, and I hate to say it was mine. We talk amongst each other. I'd say it's equal. I mean, I might have come to her and say, hey, let's do this. And she's usually the one that says you're being stupid or, hey, let's try it. And when she says let's try it, then I feel better about it. So it's probably pretty equal.
Yeah, me and my brother Mark, we just come at things at different angles.
We do too.
But I trust him. He runs it. That's why I'm not there every single day, and I'm open to do more things. And he knows that stuff. He does the specs. He's a mechanical engineer. There is no way in hell I want to do what he does. And so I kind of handle the business part that way, and then he handles the rest of it.
Well, and that's Shannon and I. Shannon says, look, you just tell me where to go and where to sign. I trust you, and don't talk to me anymore about it. And I'll do the business part. She's like, you just tell me where to go and where to be, and I'll do my job. And it works out really well. I don't try to do everything and try to micromanage, but she literally, when we're signing $1 million loans, she's like, look, I got to get back to Orange Theory. Where do I sign? Quit talking to me. And she signs and leaves. And it's worked out well because we have a good relationship, and I'm always going to do what's best for the business and, the partners. And that's why it's worked out so well.
I hear it's rare. I take it for granted, me and my brother and sister in our relationship. Nobody will take the money. That's your money. No, that's your money. You just don't do that. And it's rarer than we think. We've actually done shows of working with family because me and Katie own Paywall Ball. And then we have me and my brother, and then me and my husband. And so, I don't know that you ever get away from it. Do y'all talk about it at Christmas and Thanksgiving dinner?
We do. I mean, you're right. You can't get away from it. We try to talk about other things, but, her husband's in healthcare, so we're always talking about something. But once again, Shannon lives her life, and she enjoys being Shannon. She enjoys being a mom. She enjoys going, doing her thing and working. She still works some in the ER. And she's not real interested in the business part. Where she does come in, it's really good because a lot of times we think opposites. When we first started, I was thinking financially, hey, if we don't have a physician assistant, that's $80,000 to $100,000 more we're going to make a year. To me, it's a no-brainer. I'll just work harder, see more people. And Shannon's like, you're just being stupid and greedy. We need a physician assistant because I don't want to see 100 people a day. I want to see, I would rather take the load off and enjoy my job. And we fought about it. And she turned out to be right. We have, Lord, I don't know, 15 mid-levels now. And, we're always hiring more because it's a quality of life. It's a patient care. It's not all just financial. And so we're trying to find that balance. And that's where she's really good. She balances that part of it, and I kind of balance more the business part of it.
No, I like that. I respect that because it is rare. Just know that. It is very rare. And I saw that in my CPA world. Mm-hmm. So in the business structure, some people like to have a different entity for every location. Mm-hmm. I haven't always seen a need for that, but in some cases. So are you one big corporation with lots of employees, or are you each location is a different entity?
Every answer I give you is going to be gray. It's a mix. Okay. We have a few of our locations that's just under, say, for instance, GMUC PC, And then as we added on a couple partners, we created another LLC and say now we have GMUC of Spring Hill, which has a different partner. And then we also have GMUC of Saraland, which has all of them are base partners, but we've say GMUC of Spring Hill has an additional partner. GMUC of Spring Hill has the same base, but another partner. So we've just kind of branched out. So we do have different LLCs and not just one big one.
So when I talk about picking up at your place, can I say GMUC?
That's what we do.
Okay.
Yeah, it's all GMUC. Actually, it's kind of, the Hut did well. The Hut's got its name really quick, but it's GMUC and it's the Hut. And, then we kind of break down a little bit like Westmobile's WeMo and, Spring Hill's just Spring Hill. So really that's the big thing is GMUC. We're all GMUC.
That's the first time I've heard it. I thought it was funny.
Yeah, we're all GMUC. And sometimes you say it by accident. I know people are like, GMUC, but we're GMUC.
No, I get it. It's just so funny.
So where do you see, with the crystal ball that you don't have, what do you see changes that are fixing to hit either businesses or especially medical practices?
Man, if you were to ask me that, the answer now versus back in March are polar opposite. Back in March, I'm hoarding money, trying to get everything together because we're going to sell our house and I'm going to be one of the few doctor's offices that go out of business. And I'm looking, wow, there's going to be a lot of doctor's offices go out of business and there's going to be a lot of people that don't survive. And a lot came very close to that. And literally when you're going from that many patients down to 15, it was horrible. And a lot of people were furloughing doctors. A lot of people were laying off people. And I would venture to say we're one of the few, if not only doctor's office in Mobile. We didn't lay off any physicians. We didn't even furlough any of our physicians. We just have really good partners and we care about our docs. We care about our staff. We just hung tight, took a loss, and hoped for the best and tried to come up with new ideas and new ways of generating income. And that's where telehealth comes in. That's where testing on the side comes in. That's where preoperative testing comes in. We did a lot of stuff that people maybe weren't interested in. We were able to get through. And now you ask me, it's a total different ballgame. Now it's the opposite. We're trying to take the load off the clinics. But I'm also wary enough to know this could change overnight and we could be back to no patients again. So there's no telling. Now, realistically, I see it as being pretty crazy for the next 2 to 3 months. I see the vaccine coming out, things getting a little bit better and slowing down. I think it will get more under control, but I think that will probably be after February.
It's interesting. I've said from the very first COVID show, because I had Gia Wiggins on, I had Celia, who was an employee attorney for employers. And so, I've just kept saying, quit crying, put your big girl panties or your underoos on, and just quit crying. Look for opportunities, because there's so much out there that just revealed open for the first time for you.
You have to figure out, you have to be very fluid. And I learned that early on. You've got to find another niche, another way to get by, another opportunity. And we're really big on that. You're not going to get a laid out business plan from me other than what I got to do for the bank. You're not going to get some detailed plan. You're going to get a gut feeling. You're going to get what I feel in the community. You're going to get what I get from talking with my trusted partners. Everybody's voice is equal. We have 4 main partners, so, my 25% is not more important than my sister's 25%. But it definitely changes.
I like change. I've never been scared of change, and some people just freak the heck out with anxiety on change.
And we've had that. I mean, we have there's people in the community that can't handle COVID, and the change psychologically has become too much.
I really wanted to ask you how many mental cases you got coming in now versus before.
I mean, it's really not patience.
It's not funny. It's sad.
No. People get to the breaking point, and I feel bad. They get to the point where they don't know how to handle it. And I've been there, not to the breaking point, but I just want to go and have a nice dinner and not worry about it anymore. And I told my wife the other day, I was like, I just want to go have a margarita, have chips and salsa, and go hang out. And it gets very frustrating. And I feel like I have enough reserve where it doesn't put me over the edge. But yeah, I mean, I can see why people, I bet you, and we don't do a lot of mental health, but I bet you mental health is just skyrocketed.
I actually knew someone that went through something. It wasn't really COVID related, but needed to go just for a little while. And you couldn't find a bed.
Oh, absolutely. I'm sure you couldn't. And here's the bad part. And I don't have any problem saying this. When I was in ER before this started, the psychiatric services in Mobile were lacking. There was a glaring problem in Mobile. I mean, if I had a suicidal patient in the emergency department or an overdose, that was my worst nightmare. I don't know what I'm going to do with them. And so now you throw this onto it, and there's not enough psychiatric care in Mobile to handle these people. It's sad. When you hear about that, on the national news, it's legit and then some.
That is so sad. And I don't think there's any way that it could have gotten better during COVID with it growing so fast.
Everybody has their opinions. And I was the first to admit that, I was even wrong somewhat. I was a big lock everything down, don't get out of your house, don't do anything, lock it down. And I still wonder if we would have done that for 2 weeks, the whole entire country, which is impossible. No one's going to do it because they started listing essential businesses. Well, my yard guy's an essential business. I mean, so it became very apparent that wasn't going to work. And so now it's, I realized too, when I'm about to go out of business and my buddy's about to go out of business and my other urgent care buddy's about to go out of business, maybe that's not the best thing to do. I don't know that anybody really knows the right thing to do.
I don't think they know either.
Everybody has their opinion, and just like when you vote for president, you're going to vote for
opinions are just like assholes.
Yeah, they are, but you're always going to take care of your.
That's right.
And you're going to do what's best for you and your family, and that's how you're going to vote, and that's what people need to do with this pandemic. But the difference is also think about others. And I met up with one of my buddies this morning, as a physician, and I'm like, well, hey, let me shake your, let me give you a fist. I mean, I don't even know what to do anymore.
I know. I'm a hugger.
Yeah.
I mean, I would have hugged you 6 months ago if I met you.
And you don't know what to do. I mean, I was, my family, I just around them, I have some elderly family, and it's like I'm wearing a mask inside and not hugging them, and you feel awkward. And it's going to be awkward for everybody. Everybody's strongly opinionated, and I'm not out to get into the battle of who's right or who's wrong.
The battle of the mask.
Nope. And
nope.
I'm not out. I'm going to do what I think's right, and I'll give you my opinion, and you can take it for what it's worth. Recently,
I saw where someone actually wanted to terminate their employment because COVID restrictions were being put in the workplace. And I think that's everybody's option. I think it's every business owner's option to put them in. I think it's every employee. You choose to work there. You can choose not to work there. So I just don't think it has to be an issue.
It doesn't. And just, for instance, the vaccine is, I sent it out to my docs. Do you want the vaccine? I just want a yes or no answer. I don't want to hear the ethical dilemma behind it, or you don't trust it, or you do trust. I don't care. Do you want the vaccine or not? And I have my own opinions, but we've just got to quit being so strong-willed and strongly opinionated and just say, okay, how do we get through this? And to me, it's all obvious how you get through it. You social distance, you try to wear masks, you try to do the right thing, you use common sense. And, me personally, I'm going to take the vaccine. That's how you try to get through it. Now, if somebody else, I've heard, I've got good friends who think they're going to alter your DNA by taking the vaccine and all this kind of stuff. That's your opinion. That's fine. Don't take the vaccine. But it's just going to take that much longer to get through this.
Yeah. The only reason I don't want the vaccine is because the only year I got the flu was the year I got the flu shot.
See, and you hear that. And this is going to be no different. People are going to get this vaccine and they're going to get COVID. And they're going to get this vaccine, and probably why a lot of people won't take it the second shot is they're going to feel like crap after the first or second shot. And so a lot won't come back and get it. But once again, that's your comfort level.
Do you have to have the second shot if you had the first shot for it to really work? What's the deal?
It's a great question, but we think, from what we have known so far, you do need a booster. But, how long is that going to last? And, I know some labs are looking at antibodies, and they're going to be testing these people or in these trials for years. How long do these antibodies last? So I'm going to get the vaccine, and maybe I look like the dumb one because my antibodies lasted 1 month, and I felt sick after the vaccine. It didn't do me any good. So nobody really knows at this point. I personally, my educated guess, I think this will probably be a yearly vaccine similar to the flu vaccine.
Is that what it does? It gives you antibodies booster, and then after a while it doesn't work anymore?
No, it's there's different technology and there's different vaccines. From the little bit I've read about this one, it's newer technology that's been around, and this technology may be pretty cool in doing other things, even like fighting cancer. But you're getting injected into your body mRNA, that's like a message, a template for the spike protein on coronavirus. So basically, it gets in your body. You basically translate that mRNA into a spike protein, not coronavirus. You cannot catch coronavirus from this. And you make that spike protein, and then your body makes antibodies to that spike protein. So when you go out and you get exposed to coronavirus, your body already has antibodies to that spike protein, so it fights the antibodies on that coronavirus. So it's pretty cool technology. So no, you can't get it through it. So it's your body, it's ramping up your immune system to fight it. Now, they say 94% effective. It's not going to be that effective once it's all said and done. It'll be less than that, but that's pretty good. And there's going to be side effects. There's going to be bad reactions. There's probably going to be people, like for the flu shot, you can get something called Guillain-Barré. We get paralyzed. And it's like, oh my God, I'd never get a flu shot if I'd known that. It's a risk-benefit thing. Some people say, oh, you're just going to get a cold from this, so I'm not going to get it. Well, people can get a runny nose, and people can die from it. And so my risk-benefit analysis is I'm going to get the vaccine.
I think everybody's entitled
Absolutely.
to do. I had somebody, they saw me without a mask. They said, I'm sorry, I'm wearing my mask. I went, don't apologize for that. If that's your comfort level, wear it all day long. It doesn't matter to me.
Yep.
I need to read something, and it's making my glasses fog up.
And I'll be honest, it was so funny when my wife and I'd go to the store at the beginning of the pandemic, we would wear a mask and we felt like idiots because nobody else had a mask on. Right. And now, to me, the good thing about the mask mandate, because the same people are going to wear the mask or not wear the mask, but the good thing about the mask mandate is I don't feel like an idiot anymore. I feel like I'm more the norm. But these are all non-doctor personal opinions of how I see it now. But it's so funny how it all full circle.
And a friend of mine says she went shopping on Black Friday, and this lady was raising hell in JCPenney over there by Sephora, the makeup, about how there were too many people in that store. She said, well, then you need to leave. Don't go somewhere and then holler about how many people are there. Don't go.
You would be surprised what we go through.
I can't imagine.
Our poor girls at the front desk who work their tail off daily, what they go through. I get mad because I'm a dad, and most of those girls are young enough to be my child, and what they go through this pandemic of the way they get treated by some of these people is not right, and it's just flat out wrong. And you'd be surprised, some people have lost their mind. Some people are wonderful, caring, wonderful. Thank them for being there, doing their job, and some people just throw their pill bottles at them.
I mean, they're getting snot put all over them anyway, and then you're going to treat them like crap.
They do.
All right, everybody listening out there right now, you go thank somebody for sitting in that chair watching you be a butthead.
And the biggest thing is act like that's your daughter sitting there. Would you want somebody cussing out your daughter, throwing something at them? And I put it on Facebook. I want people to understand we're busier than we want to be, which is, I've never thought I'd say that when we first started this business. The wait times are longer than we want them to be. People are waiting. People are inconvenienced.
They don't feel good, most of them.
They already don't feel good, but we got to realize it's nobody's fault. And we're going to all work through this, but, people get, and I understand, they just get highly upset, but don't take it out on that 18-year-old girl at the front desk.
Right.
And, you can take it out on me when you get to the back. I don't care. But so it's been tough. It's been tough.
I've always told people that don't you dare holler at anybody on my team. You can scream at me all day long, but do not holler at anybody on my team.
And that's all we ask. We really want people, and this is for urgent cares in general. It's walk-in. We can't control the flow, and we're doing the best we can. And I'll guarantee you that urgent care down the road, that's my competition, is doing the best that they can. And it's too many people right now. It's the numbers are overwhelming.
Do you think you'll open up another one soon?
Not during the pandemic. When I would like to open up more, but I want this to go away or this to be under control and then find our next location.
That's the business person in you.
Yeah, I would not. It's too volatile right now to do anything.
So if somebody is looking for an urgent care, how do they get in touch with you?
So we have a website, GMUcare.com. Also, we're on Facebook, GreaterMobileUrgentCare.com. We have a pretty easy phone number, which we're just talking about. There's limitations to that, but 633-0123.
Well, with everything going on, I just want to thank you so much for coming on today.
Well, thank you for having me.
Now, at the end of every show, we give a cheers. I give one, and then the guest gives one. So I'm going to say cheers to every medical person, whether you're the 18-year-old girl at the front desk or the physician assistant or the physician or the nurses. Cheers to you, and thank you for everything that you're doing.
You stole mine. My cheers is to my staff. I don't know why they keep coming back for more. I can't thank them enough for dealing with what they deal with, from the front desk person to the nursing staff to the doctors to the janitors, every single one of them. It's a day in and day out. You get to the door and there's 20 people waiting, and you know it's going to be a rough shift, and you work through it. So my cheers to them. Hats off. It's amazing what they do.
Well, I want to let you know, too, if you have any problems with the couriers picking your test up, you can call me. I'll give you my cell phone number.
Sounds good. I will. I'll call you.
All right.
Please be sure to subscribe to Cheers to Business podcast on iTunes or anywhere else that you get your podcast. Visit our Facebook and be sure to give us a like. And if you have any questions or topics you'd like us to discuss, shoot us an email from the website cheerstobusiness.com.